Welcome everyone to Buying Local. I'm your host, Mike Nelson from Five Towers Media. Joined today by Emily Dumont from Poppy Physical Therapy. Hi, Emily.
Hi.
Hi, how are you?
Good. How are you?
I'm good. I'm good. Welcome to the show.
Thank you.
Yeah. So, Emily, just in case there's a couple people out there who haven't heard of Poppy Physical Therapy, why don't you just gotta go ahead and introduce yourself and your business a little bit?
Okay. So I'm Emily and I own Poppy Physical Therapy, and it is a pelvic floor physical therapy clinic. So we specialize in bowel, bladder, sexual dysfunction. We also do orthopedic issues, back, hip, all of that kind of fun stuff.
Mhm.
So I have been a therapist now for 14 years. Um, Started pelvic floor therapy over 5 years now after the birth of my son,
Mhm.
which had some issues, and needed to go to pelvic floor therapy myself. So went there, they hired me on, had a mentor who'd been doing it for like 20 years, and she kind of trained me, and I loved it. So then moved here a couple years ago and yeah, decided to open my own thing.
Open your own thing, yeah. What I'm curious, it's always a question I love hearing about with business owners and entrepreneurs is like, what prompted you to wanna have your own practice as opposed to working inside somebody else's practice?
Oh, yeah, a lot. I felt, there are so many restrictions when you're working inside of a someone else's practice,
Mhm,
especially like a big hospital facility, right? Like we would normally get 20 to 30 minutes with a patient, which I just didn't feel was enough time, especially with pelvic floor therapy. Um, you would also have limitations to what you could treat, right? So if I assess someone and they're leaking with running, and I was like, "Oh, well, your foot is actually a big contributor to why you're leaking with running." Um, it would be hard, especially to insurance sometimes to justify like why I'm treating the foot when they're dealing with a pelvic floor issue, right? They a lot of times wouldn't like it, um, or would deny it, or would only give you like maybe 4 visits to see somebody.
mhm.
Um, and there's always the push of getting more and more people in. Like we need to see more people. You need to see more people in a day, right? That's why like visits decreased to 20 to 30 visit or minutes. So you could see, you know, 20 people in a day. And it was just at that point, I just didn't feel like I was doing good care.
Yeah. It's interesting that you bring that up too, because over the years I've interviewed a few healthcare providers and different, modalities of healthcare, and every single one of them says that same thing, that they just could not give the quality of care that they wanted to give in that 20 to 30-minute window that they're allotted by larger practices and hospitals. And again, nothing against those facilities. They're trying to run a
No.
business. They've got huge overhead. Like,
Yeah,
I
I
can't
get
even
it.
imagine. Yeah.
No, I mean, yeah, I totally get it, right? Like insurance reimbursement goes down every year. They have to make their money somehow. So, right, that they're just going to decrease the amount of time you can spend with people so you can see more people in the door. And like, I totally understand it. It just, yeah, it's just not for me.
Yeah. Yeah, and which, to be fair, I think is amazing because it, is kinda reassuring that there's people out there that really do care about their patients and care about the quality of care and actually getting to the root of the issue instead of just, fast food healthcare where we get them in, we make a quick diagnosis, we prescribe a pill and we get them out the door, right? Like,
I know. And it's really sad because I always say, like, I think most healthcare providers got into the field to help people, right? It's
mhm,
rare that a nurse or a therapist or a doctor didn't get into the field to help people, but then I think you get in our system and you just get so worn down by the
mhm.
system, right? And it's just I think that's where the problem lies.
Yeah. Yeah, your hands are really tied and you've gotta, you gotta do what the bosses say, right? That's
Yeah.
at the
Yeah.
end of the day. It so it's fascinating to me that when you're talking about the leaking issue,
Mhm.
which from what I understand is very common for a lot of women, especially.
Yeah.
But that like it has to do with her foot. Like how, and you're
Yeah.
like that's
There was actually just a study that came out because I love research studies. There's actually just a research study that came out that did an assessment on people who leak with running, and they checked their pelvic floor, and the people who leaked with running actually had a stronger pelvic floor than people who didn't leak. So you'd think, well, if their pelvic floor is stronger, then why are they leaking?
Mhm.
But they actually determined a lot of that the foot was actually a big driver because in order to accept ground reaction forces, right, that come up, right, you have to be able to pronate or get that flat foot. That we
Mhm.
demonize flat feet, but flat feet's actually a good thing when we're talking about running and things, right? That's how we disperse forces up to our spine. And so they did this study and it showed that they weren't doing that with their foot. So their pelvic floor and their hips had to actually do that to decrease the amount of pressure going up to their spinal cord. So their pelvic floor was actually working really, really hard, harder than it really should have had to. And I find
Yeah.
that a lot of times in pelvic floor, like, that really is the issue, right? Because you should be able to have a baby, be pregnant, have a baby, all that stuff, and there are plenty of people who don't leak after that. So why are there some people who do, right? Like, usually there's some underlying thing also going along at the same time.
Yeah, I always found it interesting about with injuries, not necessarily pelvic floor issues, but just with injuries in general, where like where you're experiencing the pain or where you're experiencing the problem isn't always actually the problem. That you have to
Yeah,
go upstream and downstream from the problem in order to
exactly.
actually see what's causing it. And I just always thought that that was really, really interesting because you're like, oh, my knee hurts. And it's like, yeah, but it's got nothing to do with your knee. Your knee hurts because of above it and below it and something,
Yeah.
some other dysfunction that's going on. It's like the human body is so wild.
Which is another reason, right, where I started my own business, right? Because it also like you can't discover that in one 20 to 30-minute session, right? There's no way to assess someone's foot, knee, hips, low back, middle back, neck, right? Like in one, like you, it takes time to really do thorough assessments of all that to really determine what is causing this issue. Right,
Mhm.
and if you just don't have the time, you could be the best therapist in the world, and I think there are tons of good therapists out there, but they just don't have the time to actually figure that out.
Mhm. Do you So I think I first heard the term pelvic floor and the issues that come along with pelvic floor maybe like 10 years ago.
Okay.
But since then I hear more and more and more and more about it all the time. Is it like is this something that is increasingly becoming more of a problem or has it just always kind of been a problem and people just didn't really understand it?
Yeah, I mean, it's always been a problem. I think it's been a problem for a long li for as long as women have been having children, most likely, right? But even men, right? Even men have pelvic floors and they have plenty of issues. I would say it's been a problem forever. It's finally getting recognition, honestly, somewhat due to just social media, right? Social
Mm.
media has improved the recognition of pelvic floor therapy. Um, but I think also women are just, especially women, right? Like they're just getting more vocal about it, right? Like
Mhm.
they're just not accepting. Like a lot of times it was just like, yeah, you had a baby, so now you're going to leak a little when you laugh, cough, or sneeze. And now people are realizing, like, yeah, that's just not okay. Like you shouldn't do that, right? And I think another sad thing is when you do, like, it shows that like 50% of women, almost 50% of women actually stop exercise because they leak, right? So,
Oh,
like, just and exercise is one of the best things you can do for your body, and we have almost half of the population of women stopping it because they're leaking, right? Which is not going to improve your symptoms, right? And then it's gonna lead to a whole host of other things.
yeah. So it really was just kind of accepted, I guess would be the way to say
It
it, right?
was. And I it's sad to say, but it almost still kind of is, right? It's social media has improved awareness,
Mhm.
but, like, doctors a lot of doctors still aren't just referring to pelvic floor therapy after you have a baby, right? And they still kind of just expect leaking or pain and things like that, and it's still almost just normalized.
Yeah. Where it's one of those things where it's like, "Oh, well, you had a baby, so yeah, you can expect this to happen and
Yeah,
just part of life, right?
yeah,
Deal
and I
with it."
think, Yeah, and I think it was delayed too, right? Because people in general don't wanna talk about it, right? Like, people aren't really, like, talking about their bladder and bowel habits at the dinner table all the time, so it did kinda go under the radar for a while, but yeah, I think people are just becoming more vocal and just not being okay with the symptoms that they're experiencing.
Mhm. I'm curious. I know a lot of private practitioners that I speak to these days, not just physical therapy, but all over the board. I've talked to quite a few direct patient care providers that have, left either offices or hospitals and gone out on their own. And it seems like most of them are not accepting or working with insurance. Are you in that camp as well?
So, yes, I'm considered an out-of-network provider, right? Which means so yes, it is essentially cash pay, but every insurance is different. So I give everyone like a super bill at the end of their visit,
Mhm.
and then they can submit that super bill to their insurance. And then depending on their benefits that their insurance has, because everyone generally has out-of-network benefits, they might get reimbursed somewhat based on that. And you can
Mhm.
also use like your flex plan or your health savings account, right? Because high deductible plans are becoming really common nowadays, right? So you can even use like an HSA and things like that.
Yeah. Yeah, that whole insurance game is wild to me as well. Like,
Yes.
well, and like as a small practice, would you even be able to deal with the amount of paperwork that goes along with insurance?
You know, no, right? I would have to have like a whole billing company because there are
Yeah.
specific codes and you have to know what codes to bill where. Um, and then, just to even the amount of, yeah, like there was one insurance company that they would only give us like 4 visits. We got 4 visits. And then you'd have to fill out this whole form, send them all of your paperwork, and then you'd have to do like a peer to peer review, right? Where you're talking to another clinician on why this person needs more therapy, right? And all of this takes considerable time. It's
Yeah.
not reimbursable time, right? So every healthcare agency is different whether they're actually going to reimburse you for that time. Um, and then they would usually give me like one more visit. I feel like it was just to like appease me. You know what I mean?
Yeah.
And yeah, and I mean, one time I was on a peer-to-peer review and talking to like an ophthalmologist, and I'm like, why am I talking to an ophthalmologist? Like, shouldn't I be talking to a physical therapist? Like, but I don't know. It was just like, oh yeah, like I guess, and it was just, you know,
Yeah. Yeah. Well, not to beat up on the system too much, but I was curious about that. It's
yeah. I mean, yes, it would be really hard, right? And then they don't pay you for like 3 months, and then they can, decide to not pay you if they look back on notes and say, "Yeah, I don't think this is," right? And so then you have to decide what to do in that situation, right? Am I gonna eat that cost, or am I gonna charge that on to my patient, right? Like, because they might not tell you until you're done with that whole patient's plan of care that they're actually not gonna give you anything for it.
Mhm.
So,
Yeah. So, I mean, running a business is easy, right? Uh,
yeah.
I'm curious about how you juggle, meeting with patients and providing care and running the business and the challenges that go along with it. I think that's kind of it's similar to like people just don't talk about incontinence issues or other things that happen with pelvic floor. Like business
Yeah.
owners don't always talk about like how hard it really is to do all the things, right? I'd love to hear about how you're handling all the many hats that you have to wear in a daily basis.
Gosh, I don't know. I mean, it's hard. I'm still learning, right? Like I just opened in January here. So like I feel like I'm still so new to like running a business, and like the patient care I love and that part I can handle, and then all of the other stuff is stuff I'm not used to, right? Like so I am trying and I'm learning and right, it's all just experimental.
Yeah.
Um Especially because right, I have 2 little kids running around most of the time, but luckily my husband is very helpful, that's great, and his job is a little bit more flexible, I would say, than mine, so that's really
Mhm.
helpful. Um, I also have a business coach, so that's helpful to kind
Nice.
of teach
I think
me a
everybody
little bit.
should. Yeah.
Yeah,
Mhm.
I mean, I have all the spreadsheets and all right, like, I don't know how to do that stuff. So that has been very helpful. Um, but yeah, I don't know if I have a good answer to that. It's hard. It's
Yeah.
really hard.
Yeah. It
Um,
definitely is.
basically I try to spend as much time with my kids as I be with them when I could be with them. But and then, when I'm at the office, I am like doing everything, right? I'm trying to meet with other healthcare providers and yeah, do my patient care and um do my notes. I still have to do all of those.
Mhm.
But I think I have a lot of lists
Yeah.
and I usually try to do the things that I don't want to do first and then work from there.
That's fair. Right. And then kick down kick whatever cans down the road that you have to, I guess.
Yeah. I mean, for right now, it's just me. So like, right, like everything falls on me. But
Mhm.
um, yeah, I mean, honestly, nights after my kids go to bed, that's when
On the laptop.
yeah, that's when I
Yep.
do a lot of work.
Yeah. Yeah. I think we can all attest to that for sure. Um, so now you said you just opened in January,
Yeah.
but didn't and do I remember this correctly that you opened in January, but you've already had to move offices to get more space? Or did I make that up?
Yes. No, I did move. I
You did.
moved to so I'm on Maple Ave in Saratoga and I was at this it was a lovely space on Maple Ave, but it was just a little bit too small. And so now I moved into another space where I have 2 offices. So I have one where I have, like, my treatment room, and then I have another that's more devoted to, like, exercise, right? And, like, being able to do more exercise and things like that because I do love incorporating exercise into what we do.
Yeah. So that's good though. Sounds like, good sign of growth and patience and,
Yeah,
things
no,
like
it's been great, and I love the space where I am now. So yeah, no, it's been really great, and I love to have the ability to have more exercise, especially, right, if someone's, like, leaking with running. Right, I have, like, a little treadmill and things like that where we can really work on things,
Mhm.
um, versus just being in a room with a table and minimal space.
Yeah. So what are some of the signs or symptoms that people might have that they should start thinking like maybe I have a pelvic floor issue? Like what does that look like initially for men and women?
Okay, so any form of leaking or any form of urinary incontinence is something that we don't want, whether it's lapping, sneezing, coughing, running, all of it is not okay.
Mhm.
I would also say urinary urgency or frequency, right? If you get an urge and you feel like you have to pee and then you can't hold it on the way to the bathroom, or you feel like you have to run to the bathroom, right? Those generally are things that we don't want. We don't want you going to the bathroom um, more than every 2 to 4 hours, right? Every 2 to 4 hours for peeing is considered okay. But if you're going more than that, then maybe you have some frequency, right? If you're leaking with your bowels, that's unacceptable. Any kind of constipation. Constipation a lot of times can be a
Mhm.
pelvic floor issue. Also, pain with sex, right? You shouldn't have pain with sex. That's unacceptable. And I think a lot of people, especially a lot of the older generation, were just taught that that was okay.
Mhm.
Um, so those things, right? Any kind of pelvic pain, actually low back pain and hip pain are both really correlated with pelvic floor issues too. Um, and then we can go into like prolapse, right? If anyone feels like they have prolapse, any heaviness or bulging feeling, that is something that we'd want to work on because that probably means that you have some sort of pressure management problem. Um, and yeah, any bowel, bladder, or sexual dysfunction, pelvic pain. Gosh, I feel like I'm probably missing whether they're having difficulty peeing or unable to control it. Even ED can be a sign of pelvic floor issues, right? So, um, all of that and more.
And more, yeah.
Yeah.
It's wild that, again, it kind of like we talked about before, but as you were saying, it's just like you have hip pain or back pain. Like your first thought is not going to be that I've got a pelvic floor issue. It's that I've got back pain. So I'm going to go
Right.
deal with the back pain. Right.
Right.
Um, yeah.
Yeah, like I always tell people, like I have my little pelvis model here, right? I always tell people, like, so this is like your pelvic floor, but like this is a hip muscle,
Hmm.
right? That's a hip muscle and that's your pelvic floor. So, like, how are they not related? And in some way.
Yeah. Yeah. So what does the future look like for Poppy Physical Therapy? Like what's next?
Here is just to help as many people as possible, right? Like I have been through it. I had pelvic floor issues after my son, and I know the fear that comes with that, right? Like,
Mhm.
I mean, it's terrifying and it's embarrassing and you don't want people to go through it. So if I can help people like not feel that, um, that's my goal. Right? Like I want to help as many people as I can. So I want to just, yeah, that's what I want to focus on, just being in the clinic, helping as many people as I can.
It's amazing. So if people want to get some help or want to think maybe they have an issue, where do they find you guys?
So yeah, I have Instagram and Facebook at Poppy Physical Therapy. You can always send me an email. It's info@poppyphysicaltherapy.com. My webpage is just Poppy Physical Therapy. Um, all of it's online. You can call me, all that good stuff.
All
Try
that.
to be, yeah, try to
And
be as everywhere as I can.
yeah, and now accepting new patients, right?
Yes, always accepting new patients. I think that's the good thing about being with like this kind of practice too is like, yeah, I'm always accepting new patients. I can usually get people in within a few weeks. Um, so that you're not waiting, you know, 6 to 12 months to get your pelvic floor issues like a lot of like other places I know they really have
Yeah.
crazy, crazy wait lists. And the longer you wait, the worse your symptoms tend to get.
Yeah. Yeah, it's not gonna go away on its own.
No, unfortunately not.
Well, Emily, I really appreciate you coming on, and I know you've got a crazy busy schedule, as all business owners do, and, so taking a little bit of time to talk to me and our listeners, really grateful, really appreciate it, and, excited for your practice and what you're doing.
Awesome. Thank you so much.
Yeah, absolutely. And thanks everybody for listening. Of course, you can find us at buyinglocal.us and you can listen or watch our podcasts on Apple, Rumble, Spotify, and YouTube. Thanks for listening, everybody, and you'll hear from us next week.